everyone. I'm J.C. Kasky, Professor of Cardiovascular Science at St. George's University of London, and I'm delighted to be taking part in this educational program. Will comprise 3 modules on the management of chronic coronary syndromes. The first module will be based on managing chronic coronary syndromes in clinical practice, which are the challenges we have in terms of preventing disease and controlling symptoms. The ESC guidelines were modified in 2019, and they introduced very interesting changes. The first one is that rather than talking about stable angina or stable coronary artery disease, they talk about chronic coronary syndromes. And this is to emphasize the importance of different mechanisms of myocardial ischemia, not just obstructive coronary artery disease, but functional mechanisms as well. And they gave us 6 different clinical scenarios where you can see obstructive coronary artery disease, functional mechanisms involving the myocardium. So a more comprehensive way of dealing with angina pectoris or ischemic heart disease. The problem, however, is that the current paradigm for most cardiologists still is that angina pectoris means obstructive atherosclerotic epicardial coronary artery disease. This is, for most cardiologists, the cause of myocardial ischemia, and therefore diagnostic and therapeutic strategies for angina are largely determined by this paradigm. And it is not only physicians who feel like that, but also patients. Both see coronary artery stenosis as a mechanical problem that can be fixed by mechanical means, by dilating the coronary arteries. However, as we showed some years ago now, the causes of ischemic heart disease are many. Obstructive coronary artery disease is just one of the ends of the spectrum. And at the other end of the spectrum, we have coronary artery spasm. But in the middle, we have problems with the coronary microcirculation, which is able to cause angina exactly as coronary artery spasm or obstructive coronary artery disease can do. And microvascular dysfunction can appear in the form of structural abnormalities in the microvessels or functional problems like microvascular spasm or myocardial factors that can affect the function of the microvessels.